Hey everyone, Dr. Charlie Oliver here, your chiropractor and physical therapist practicing in San Antonio, Texas. If you've been struggling with shoulder pain and stiffness that just won't go away, you might be dealing with something called frozen shoulder. It's frustrating, it's limiting, and it can feel like it's taking over your life. But don't worry, today we're gonna be breaking it all down. Now, I'm going to explain what a frozen shoulder is, how it happens, and most importantly, what you can do in your daily life to start managing it and get on that road to recovery. And stick around to the end of the video. I'm going to go a little bit off script and really give you my thought process when it comes to this very odd condition. If you have it, you know this already. It is different than a normal pain, such as a tendonitis or a tear, where it behaves very predictably and very logically. It's just different. We'll touch on that in a few. So first of all, what is frozen shoulder? Let's start with the basics. So frozen shoulder is also known as adhesive capsulitis. It happens when the connective tissue around your shoulder joint becomes thickened and inflamed. This limits your shoulder's movement and it makes it painful to do even simple things like reaching for something or putting on a jacket. Frozen shoulder typically develops in 3 different stages. Number 1 is a freezing stage, where the pain and the stiffness gradually worsen. Next is a frozen stage, where movement is severely restricted, but pain starts to diminish. And then up next is a thawing stage, where mobility slowly starts to improve. This whole process can take months, even years without proper care. One of the most important things you can do for your shoulder is to keep it moving, but make sure you're doing it gently. Total immobility only makes a problem worse. Now, even small, pain-free movements like pendulum swings or shoulder rolls can help maintain mobility. The key here is not to push through sharp pain, but also don't let the joint freeze up entirely. First easy step is applying heat to the shoulder for 15 to 20 minutes. That's going to help relax tight muscles and improve blood flow to the area. Next, you want to follow this up with gentle stretching. Now, I'm going to cover a few exercises right here, but keep in mind with this, frozen shoulder has a huge spectrum. In other words, some people have frozen shoulder, but they're just lacking maybe 10 to 15% of normal motion, and maybe they have a little bit of stiffness, maybe some pain, again, up at the end of their range. And then you have someone else. That other person could have severe pain, severe stiffness, where they can't even reach into their back pocket. So in other words, an exercise for one person who can do the exercise relatively easily is almost impossible for someone else. Now, let's start with one of my favorites, the cross-body stretch. This is one of the easier exercises to perform. And what you're gonna do with this one, you're gonna take your elbow on the affected arm and you're gonna bring it across your chest. Now hold this for at least 20 to 30 seconds. Matter of fact, you can hold it even longer. I'm a big fan of a prolonged gentle stretch, giving the tissues time to relax and truly release. But do it for a bare minimum of 20 to 30 seconds. Next up is a towel stretch. For the towel stretch, you're gonna drape a towel over your shoulder. You're gonna grab the ends with both hands. Next, gently pull the affected arm up behind the back. Now I'll tell you this motion is limited in everybody with frozen shoulder. It's gonna be really painful. Okay, you're gonna feel a really good stretch. The balance there is giving your body enough stretch without inducing too much pain. Again, you wanna hold this for a good 20 to 30 seconds. My third favorite stretch for frozen shoulder is a table stretch. Now, that's exactly like it sounds. What you're gonna do, you're gonna have a seat next to a desk or a table, and you're gonna put your arm on it with the thumb facing upwards or the palm facing upwards, just not downwards. Next, scoot your chair backwards or slide away from your arm. So in other words, what that's doing, essentially, it's stretching your arm upwards. Now, if you have really good motion with this, and you're just lacking a little bit at the top, that's where you're gonna wanna be up against a wall, and you can actually kind of put your arm up on the wall and then lean your body into it. Now, in addition to all this, remember, posture matters when it comes to the shoulders. We spend so much time looking down at our screens, being hunched over, and that's just gonna put even more pressure on the shoulder. So whatever you can do to reduce the time sitting, reduce the amount of time that you're slouching, do it. If that means sitting in more of an upright position, that's actually gonna help your shoulder. Also remember, take frequent breaks. Get up, walk around, loosen everything up. Now, what I just shared with you is kind of textbook information for treating frozen shoulder, and it is great info and it is going to help you out. But I'll tell you this, after working on frozen shoulders for 26 years, I can tell you this, frozen shoulder is still somewhat of a mystery. There's things when you start practicing, kind of trends you start seeing with your patients, and something I noticed years and years ago, which was substantiated by some really good seminars I went to later on, was I was noticing you tend to see frozen shoulders in women more often than men, and a lot of times it was like in a menopausal or premenopausal aged woman. And for some reason, a lot of times it's on the opposite side of the dominant side. So in other words, people are right-handed, right? A lot of times you start seeing this on the left side. And so what this means is that there is an odd hormonal or inflammatory component to it. And also I would have patients sometimes who would go see their medical doctor, and there's a procedure called a manipulation under anesthesia. So in other words, they go to the operating room, they're knocked out, they're unconscious, and the surgeon will take their arm into all different directions, popping these adhesions. And so while they're under, and for the next day or so, they have full range of motion. And guess what? Within a few days, magically, they start losing some of that improvement. And so I would see this in my physical therapy practice, and it was such a weird mystery. But what it goes to show is a very weird animal. There are systemic conditions that will cause a frozen shoulder and perpetuate it, but these exercises, at least they're gonna help you mitigate this. So let me recap. If you've been diagnosed with frozen shoulder, do these exercises and take the advice I detailed earlier in the video. But also go see a really good physical therapist, someone who has credentials in manual therapy. There are countless great approaches in both chiropractic and physical therapy, and each has a slightly different take on this condition. A good physical therapist will use his or her hands to hit trigger points in the shoulder, as well as mobilize and stretch the parts of the joint capsule. Also, go see a chiropractor. Chiropractors are going to look at the whole person. Now, they're going to look at your neck in particular, as the nerves from the neck lead down to the shoulder. They may even work on the rib cage and the thoracic spine as well, and work on your posture. Either way, go see both a physical therapist and a chiropractor in addition to an orthopedic surgeon. In my experience, not a single profession has a complete grasp on this condition where they can fix it 100% of the time. This condition needs a widespread approach to get you back to normal as soon as possible. So to sum things up, get the shoulder moving with heat and gentle stretching, use good posture, and find a great physical therapist and a great chiropractor. Be patient and be consistent with their recommendations, and you can start taking control of your recovery. And remember, I'm here to help you out every step of the way. So drop me a question in the comment section if you have one, or if you'd like me to cover a different subject in a future video. And as always, don't forget to like the video, subscribe for more tips, and share it with someone who might need it. So take care, and I'll see you in the next video.